It was actually thought that this was going to be the way that dentistry was going to go, that we were going to make that patient our partner in their treatment. I think today we're trying to get back to that. I'm hoping that we can come back to a more centered approach and realize that you have to make that patient your partner in their treatment. 3 747s crashed every day in the US. That would be how many people are being killed by smoking still. And at each appointment, in a non-judgmental way, you're saying, hey, how's that smoking going? Are you still smoking? Yeah, I know you're going to lecture me. Not my place. I'm not going to lecture you. I just wanted to ask you a couple of questions. Is that okay? The best thing you can do is ask permission.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.
Welcome back, everyone, to another episode of A Tale of Two Hygienists, an Endeavor Business Media production. I'm your host, Andrew Johnston, and thank you so much for making us a part of your day. We have a great show for you today as we welcome in our new friend, Sherri Warshaw, and we listen to how she explains nicotine addiction. One of the things I really liked about it is she talked a little bit about what collaboration looked like in dentistry over her career, because I tell you, it is so much different now than it used to be. I also want to let you know, I am absolutely blown away by the constant discovery of new people in kind of these circles that we run in. I couldn't tell you really, or I just don't recall how Sherri and I became connected on LinkedIn. And I think that sometimes you think that, you have a social media friend or a connection, and that's just what it is. They sent you a friend request. You said, hey, they're a hygienist also, accept. And you don't really look into it more. And so now they're a part of your circle, but you don't really get to know them. And so then you get to talking a little bit and you realize, like, there are so many brilliant hygienists out here in this world. And I am utterly amazed by the things that people do and how little I know about these different facets of hygiene. So I'm really thankful that I was able to meet Sherri. You're going to enjoy this episode. And then next week, we're bringing on another new friend, Ellen Myers, and she's going to discuss oral cancer and oral cancer screenings. We mentioned this on the episode, but the stats are absolutely staggering. Oral cancer screenings explode for the month of April, right? It's Oral Cancer Awareness Month. We all know about that. But then all of the other months, boom, it plummets again. And so even though it's May and it's not Oral Cancer Awareness Month, hopefully Ellen will give you a few thoughts to help you kind of adjust your practice. And maybe those times when you're overworked and you're underappreciated and you just don't want to see one more patient, maybe you'll just have it in you. You'll find the strength to be able to do that one extra oral cancer screening. So it was a good episode as well. You're going to enjoy that one. And then I want to give a shout out and say thank you to Elizabeth. Elizabeth is a hygienist in Florida, and she emailed me last week regarding the laws around hygienists injecting Botox, specifically in the state of Florida, but she wanted to know all of the information. And so I'll briefly explain what we discussed kind of back and forth via email. But I want to let you know it does not have a satisfying ending. And this is where you're going to come in. But first, let me set this up. So Elizabeth was doing some research on courses and the laws in her state, so the state of Florida. Several of those websites that are not affiliated with the state's dental board listed, here's a handful of states that are legally allowing hygienists to administer Botox. And Florida was on every single one of these lists. Now, as she was double checking, like she should, she could not find it written into the state legislation. And from what I understand, they were also looking into what kind of liability insurance that she would need to carry. And in doing so, it appeared that she would not be covered as an injector of Botox. But the answer of why wasn't really made clear. And so she reached out to me and asked if I knew anything. I spent several hours poring over the Practice Act and reading memos and amendments to rules from committees, literally everything that they post online that I can get my hands on. And there's no answer of could she legally administer or not? Like literally nothing about, there's no Botox, dermal fillers injected, like nothing in there. What I did find, and what I guess is meant to be understood, is that This is under the understanding, I guess, of a delegable duty under the direction of a dentist, but it's not explicitly stated. It's not even implied for that matter. And so, who in their right mind would want to take that chance, risk everything because it's to be assumed? No, thank you. I should also add that she did reach out to the dental board and she reached out to the Florida State Dental Hygiene Association, and they were of zero help. So, if there are any like super sleuths out there, anyone that knows Florida rules and regulations super, super well, that could help us out, I'd be really, really grateful. One, because I just want to know the answer to it, because now that I'm living in Florida, it directly affects me. But also, too, so that we can get this information out there for everybody. We are looking for specifically the law and or the rule that makes this possible. And so bonus points if you find it in chapter 466. If you know the answer, please email me, andrew@ataleoftwohygienists.com. I think that is all for me for this week. Thank you so much for listening. Enjoy this episode with Sherri Warshaw.
A tale of two hygienists.
Welcome everyone into the interview portion of the podcast. I am joined today by Sherri Warshaw. Thank you so much, Sherri, for making some time to meet with us today.
Thank you. I'm so happy to be here and chat with you.
Oh my gosh. So the thing about you, I wanted to really kind of dive into your history, and, we were talking a little bit off air, and like the same, you identify with the problems that most speakers have. Like you're a very polished professional, like, like all of the things. And I kind of want to get into where you started and then what led you to this point, because I feel like you've had a creative and interesting career so far.
Well, thank you. Thank you for thinking that I'm creative. I like to think that I'm a creative thinker. This is actually my 51st year in the dental world.
Wow. Congrats.
Thank you. But I like to say I started at about age 5 because my mother was actually a dental phobic. And that's actually what got me interested in dentistry, because as a very small child, I was sitting there holding her hand instead of the opposite.
Interesting.
Yes.
And you don't feel like that created any phobias for you, like your own self?
Well, I don't love sitting in the dental chair. I love being in the dental operatory. That's my favorite thing.
Yeah.
So as a kid, I was looking around at everything and thought everything was really cool. Now, mind you, this is back in the days of belt driven. And even when I started in dentistry, I used a belt driven handpiece.
Wow.
So, I've seen the evolution go from belts to digital. And now to AI, which is really exciting. So to get back to mom kind of guided my career even to where it is today, because obviously she took me to the dentist. She never went in with me. She just kind of dropped me off. And I had horrific dental experiences for another show that made me very, very interested. I always wanted to be a dental hygienist. I moved to Florida when I was about 18, 19 years old, and I wanted to go to Miami-Dade. They had a great hygiene program at the time, and that was 100-person wait list, 100 people.
Wow.
So I diverted. I went to dental assisting school and started as an assistant. And back in the day, expanded duties meant that you were sort of like a preceptorship. So yes, I was a trained dental assistant, but I also was trained by the dentist to do a lot of procedures, much more fly by the seat of your pants than it is today, the advanced functions or an AQP or whatever.
Sure.
Flash forward, I went on an interview in a perio office to become a plaque control therapist. What is that? In the 1970s, plaque control was all the rage. So believe it or not, 50 years ago, we still knew that plaque was evil and we had to get rid of it, but no one was ever taking the time to educate patients. And so I worked in a perio office where I had 5 visits to educate the patient on oral hygiene before their scaling and root planing.
What?
Yes.
Wait, how does that work? I mean, what do you talk about during those 5 visits? I feel like it'd be the same thing over and over again, no?
No, because it was 3 days in a row. So the first day, you're kind of explaining what's going on. Day 2, you're introducing certain modalities that you want. These are all perio patients, so these are all very involved. So, we were using water pick, very, very little water pick back then because it was before the studies. Flossing, correct brushing, interdental brushes, perioades, irrigators, whatever I could use to remove plaque, I was using. But you're also sitting there building up this rapport with this patient, because I'm locked in a room that's 7 by 7 with a window, the size of a paper plate. And it was a fantastic job. I loved it. I did it for almost 10 years.
Oh my gosh.
Yeah.
How do you feel about, I mean, because I feel like as a hygienist, you like look like, hey, what would be like the best way for motivating patients and educating? That way sounds very effective compared to our 5 minutes as we are polishing or as we are scaling to try and educate them and get them to do all these things. How do you feel about like kind of, I mean, the shift into like today's like go fast paced?
I feel sad.
You should, right?
Yeah, yes. So, so if you think about that model, so the model was 3 days in a row and then a 1 week check and then a 2 week check. So over a period of a month, you're making sure that the patient is removing plaque on a daily basis before you're doing your treatment, not sitting there while you're doing your treatment, trying to bring them up to speed. If they didn't pass my little course, guess what? They didn't get their scaling and root planing.
No way.
Way. He did not employ a hygienist until after I left. So at the time, I was still an assistant. I was not a hygienist. And the periodontist did all the scaling and root planing himself. So we were a team. There was an assistant, a periodontist, myself, and we were like a dance. We were like one. And it was a fantastic, fantastic opportunity for me, but also he was my greatest mentor because we would discuss the patients and we would sit down, we would talk. Now, segue, what was he doing when I was giving him the lowdown? He was smoking a cigarette.
Of course he was.
Yes. But I worked there from the early 70s till 1981. Okay. So that was, still in the heyday of smoking.
Yeah.
He actually quit with a program back then. It was called Smoke Enders, where every cigarette you smoked, you kept a horrible jar and you put it in this jar with water and then you opened the lid and smelled it. It was a real negative reinforcement.
Yeah.
But what I will say is that platform of those 3 days and then the 1 week, 2 week check really goes into what I use a lot today in smoking cessation, which is motivational interviewing, which is getting to know the person and letting them lead themselves to the behavior change, as opposed to the 5-minute speech of pointing the finger.
Yeah. That lecture of like, you do better with, wagging the finger at them. They're not good enough.
Exactly.
Yeah. I mean, I think obviously we're kind of leading there already talking about smoking cessation, but like I want to so how did you get into that being a driver and you creating a course on it when you had this awesome mentor who was a smoker?
Yes. Well, so he wasn't the impetus for my smoking cessation. So we'll fast forward, have a few kids. I went back to school at the age of 37. I graduated as a hygienist at the age of 42. I was number one in my class. I was number one in the university.
Of course.
I was driven.
Yeah.
I got a job in a perio office as a perio hygienist, and I taught in a clinical hygiene program in the clinic. So techniques. So what I was constantly seeing was all of this perio disease I was focusing on, along with dental disease, but my main focus was perio, and that correlation between those smokers. Now, why did I segue into specializing into smoking cessation? We go back to mom. So mom, on my birthday in 2005, gets diagnosed with oral cancer. She had not had a cigarette in 10 years. Because she smoked herself into a stroke 10 years before. So my mother died of an oral cancer. And of course, being still a dental phobic, even in her later years, obviously, if it had been caught earlier, she would maybe even still be here. But it definitely was smoking related. So I left clinical hygiene around 2012. And I was kind of bereft because here I have all this experience, all this knowledge. And so I went on the internet like everybody else. And I said, what the heck can I do with what I know? And lo and behold, I found this area of expertise called tobacco treatment specialist. I applied to the Mayo Clinic to become a certified Mayo Clinic tobacco treatment specialist. I waited a year to get into their program. It's pretty selective. And at that point, I was only a handful of dental people who had gone through the program. So I went through, got my certification, and that's what brought me here today. And so for the past 10 years, I have been doing this.
Do you mind if I reel us back to one? So I just thought of another question, kind of just like back in the day of these 3 days of kind of motivating and interviewing and questioning and getting that. So a couple of different questions. One, how did the periodontist feel at the time? I essentially paying you to talk to these people, and why was the mindset back then of, if you don't get this motivation under control of home care, then I'm not going to treat you? Like, why is that important then, but it doesn't seem to be as important anymore?
Well, so might add, this was in Coral Gables, Florida. I practiced on a street of unbelievable practitioners, one of which was Lindsay Pankey.
Oh,
of the Pankey Institute.
Pankey Institute, yeah.
I was there at the founding of the Pankey Institute. All of those dentists who taught and founded Pankey were amongst my colleagues. And so Dr. Pankey was one of the first people to look at the whole person and to treat kind of the person and create kind of that medical dental connection where we're not isolating the mouth. And so I think because he was such a mentor to my mentor, and also at the time, there were all kinds of different the Kai's technique with salt and baking soda. It was really in the early stages of plaque. And at the time, we didn't understand the difference between aerobic and anaerobic. It was all plaque is bad plaque. Look at this. It's pink. We have to get rid of it, to boil it down to the simplest. But it was actually thought that this was going to be the way that dentistry was going to go, that we were going to make that patient our partner in their treatment. I think today we're trying to get back to that.
Yeah.
But dentistry is in such a flux right now between private dentistry, DSOs, home dentistry, doing your own orthodontics through the mail.
Yeah.
That, we're kind of like an octopus. I'm hoping that we can come back to a more centered approach and realize that you have to make that patient your partner in their treatment. And that's what I was good at.
I just love that because I really do feel like, I don't want to say it's altruistic, 'cause I'm sure it's, still a money making event, and the doctor's not like hard up for cash, but I feel like, the motivation to be a periodontist or be a dentist or be a healthcare professional probably in that time was a little bit different than people's motivations now, where it's like, I want to work 3 days a week and make a lot of money and then go play golf on on Thursday and Friday and have a boat and have a nice, I feel like it's a lot more driven on the money aspect for many people, as opposed to kind of like that altruistic, like, I want to help people get healthy. You are my neighbor and I love you and I want you to be here forever and we can, be a community together. I feel like that's way different.
But one thing I will tell you though, he was an anomaly because we were in an extremely wealthy area where back in the day, their insurance coverage was fantastic. If they didn't have insurance, their pockets were fantastic. I will tell you that I made many a trip to the bank for him. And I also bought Krugerrands. Krugerrand is a South African gold coin.
Yeah.
That had just come into play in those days. And so we treated a lot of people who came from out of the country. And so I had many jobs with him. But trust me, he had a boat, he played golf, and he belonged to the country. And he walked out of the office every day at 4:45.
Of course. So really some things haven't changed then. Okay. So my other question was, you went to the Mayo Clinic to get some certification, some training, but it sounds like though that you were still doing some of this motivational interviewing for home care before that. So what was the training and how did you understand what questions to ask, in what sequence, how to ask open-ended questions, like all of kind of the staples of motivational interviewing? How did you learn that yourself?
I don't know how I learned that myself. I think that I just, my children will tell you that I am the queen of the single serving friend. I can be sitting somewhere. Well, for instance, I just got back from a trip. I can be sitting at the pool. I can be sitting at a restaurant. I can be waiting in line somewhere. And in a very, very short time, I can get a person to connect with me and tell me all about themselves. And that's what we call a single serving friend. Now, for some single serving friends, I've actually made friends. Mm-hmm. But I love people and I love to hear their story. Now, I'm telling you my story now. I also like to share my story. I mostly like to share my story with other dental professionals because I like them to see that when I was 17 years old and dying to get into hygiene school, how could I have ever predicted that at the end of my career, I would be doing a podcast and talking about smoking cessation? You can't.
Right.
Predict where you're going to end up. But I'm a lifelong learner and I in fact, I've been audited a couple of times from my license renewals, I think because I put down too many courses. So it's like, yeah, you didn't do all that. Yeah, I did because I love to learn and then I like to share what I know. So as far as, how did I get those motivational interviewing skills? I don't know. I osmosed them, but what happened during my training and what kind of opened my eyes was learning more about those open-ended questions, mm-hmm. decisional balance, empathy. If I could stress one thing about smoking cessation that I think a lot of us in the dental profession maybe don't express enough to our patients is being empathetic about their addiction.
Yeah.
And I think that's really, really important.
I would agree. I think sometimes if you don't, walk a mile in their shoes kind of a thing, like you don't understand, like there's no way. I was watching, this is a complete segue, but my wife and I started watching ER again, which I've actually never watched ER, but that's from 94, 95 when it started. And there was one of the main doctors who was kind of a little bit of a jerk. Well, he wasn't the main doctor, but he's like one of the higher up in the office. And he was kind of a bit of a jerk. And he was kind of giving one of these other doctors a hard time. And then he had a cardiovascular event himself and then had to be treated by that doctor he was being a jerk to. And then afterwards, he's just like, I wish every, cardiovascular surgeon had a heart attack so they could understand what the patient is really going through at the time. And like, they could be such a better clinician for them. And I feel like that's very similar kind of what you're saying. I think that you should have your own podcast, by the way, because I think that you are a great, like, what did you say? A single serving friend? Like that would make for a great podcast.
Help me with that.
Happily doing that for you. Okay. So let's get into it. So you went on the internet, you saw that there's these courses. My personal feelings or my kind of observations, which may or may not be right, is, smoking cessation doesn't seem to be the problem that it was in the 70s, the 80s, the 90s, and early 2000s. It seems like I'm constantly seeing that, tobacco use is down. I mean, vaping is up, but I think, tobacco use is down. So how does that still play for you as far as finding, I guess, the relevance to continue to speak about this?
So great question. Little known fact. Yes, smoking rates are down, but smoking still kills in the U.S. alone almost 500,000 people a year. So they say it's about 480,000. So picture this. This is a Mayo Clinic kind of analogy from my mentor there. So if 3 747s crashed every day in the U.S., that would be how many people are being killed by smoking still.
Whoa.
Right. And it used to be said that if you tried to pass alcohol or smoking today or cigarettes today, you could never have those products.
Right.
But every time we try and do things with tobacco control, the lobbying efforts are so intense. That's why cigarettes are still being sold. And so your e-cigarettes came into play was, this is part of Big Tobacco's plan to move people. Part of the problem was, you mentioned cardiologists. A lot of cardiologists, internists, family physicians started telling people to migrate towards e-cigarettes as a way to quit smoking and as a harm reduction, which harm reduction is great in some things, but I'm not a believer of it in smoking cessation. That's that opinion piece, okay? To me, it's a little bit pregnant. You're either smoking and addicted to nicotine in some form, or you're not.
Sure.
So I do not use e-cigarettes as a smoking cessation modality. I'll only use things that are FDA approved. There is no FDA approved e-cigarette. But so you asked, why is it still relevant? It's killing people at tremendous amounts. The other problem is it's targeting African Americans. There's at least 50,000 deaths right there attributed to tobacco every year. It targets the mentally ill, the substance abusers, LGBTQAI. They smoke at a rate of 50%. I just got back from Las Vegas, and they're still smoking everywhere. In fact, when I was in the airport, I took a picture. The picture says it's a non-smoke airport, but they have two different smoking lounges within the airport.
Yeah.
So, you're talking about somebody who gets to a lawmaker and says, hey, this is revenue for us. Not only are they eating food, flying in here, spending money on entertainment, but they're also buying cigarettes and gambling. And hey, let's give them their own space. So we're kind of at this tug of war between social and health. And health would dictate, cigarettes should be outlawed. That is not going to happen, at least in the foreseeable future.
Sure. Can you define for me, I guess, or maybe it's not like a true definition, but like the parameters of addiction? So, we're taking our medical dental histories with our patients and we have a smoking part of it. Like, what would you classify as someone that has a nicotine addiction?
So a nicotine addiction, again, now it has evolved and it's kind of changed. To me, you're addicted to nicotine if you use it in any form at any time. I'm not talking about gum and lozenges and patches. Those are pharmaceutical nicotine. But even if you're a social smoker, even if you're a closet smoker where you're only, I only smoke when I drink. I only smoke on the weekends. I only smoke 5 cigarettes a day. I hear that a lot. I only smoke 5 or I only smoke 10. You're addicted. You are addicted. You're just managing your addiction. Not every alcoholic is drinking a liter a day. There are alcoholics who are drinking 2 or 3 drinks a day, but if you have them not have that, they're going to go through a withdrawal. So nicotine, one thing we know about the addiction is that it is, and there's a fine line. Some people say it is the most addictive chemical known to man. Other people say it's top 3. I would say from the studies I've read that it is the most addictive chemical known to man.
How do you classify or maybe determine between someone who smokes because they are addicted to nicotine or those person that we hear all the time, they've been smoking for 40 years and it's not so much the nicotine anymore that they want, but they want that habit where you hear about the person that'll just go outside and stand on their porch and just like put a stick in their hand and then just do the mechanical like habit right before bed just so they can get that out of their system. How do you define between the two?
It's a very different question. So that hand to mouth thing is a habit, you're right, but that's very separate from a nicotine addiction. That's something that they're using as a form of, this is how I end my day. And sometimes even with, smoking cessation, I need to know, how do you smoke? Where do you smoke? When do you smoke? Why do you smoke? What do you smoke? How long have you smoked? Have you ever tried to quit? How many times have you tried to quit? So you can imagine this is a very all-encompassing perspective, because it's really going to help somebody. You have to know all of that. And, obviously with HIPAA laws, my head is full of so many smoking secrets from people and ways and how and where they smoke. It's mind-boggling.
I bet. Oh my gosh. I have one last question because I know we're running short of time, but I feel like, as a new hygienist, I tackled these conversations a little bit differently, right? I'm a little bit apprehensive. I'm a little bit nervous to, quote unquote, question somebody about this bad habit that we all know is bad, and including the patient knows that it's not good for them. So when you have a patient that's maybe relatively defensive or maybe shut down, like maybe they're not like lashing out at you and like screaming, that's not your business, not that kind of patient, but you're trying to open them up through open-ended questions and they're just like completely shut down, blocking you out. What are some tips or some tricks or something that someone could use for these difficult patients that we have?
That's a great question. And in the trainings, of which I've taken many, there's very little you can do about that. It's kind of sad. So what you keep doing is at every appointment, and now mind you, hopefully you're going to see this patient at least twice a year. The beauty of doing it in perio is I was seeing them at most times 4 times a year, because very often they were coming back to us. And at each appointment, in a non-judgmental way, you're saying, hey, how's that smoking going? Are you still smoking? Yeah. I know you're going to lecture me. Not my place. I'm not going to lecture you. I just wanted to ask you a couple of questions. Is that okay? The best thing you can do is ask permission. Is that okay? It's very different from, I'm going to ask you some questions about that smoking.
Yeah, coming in hot on that one.
Coming in hot. And so, I could tell you many stories of people who I worked with. I was in the same office for 15 years. And year 1, there was no way they were going to quit. And by year 2, 3, 4, they quit. Quit.
Yeah.
So it's a process.
Sherri, I'm so glad that you're joining us today. I think that there's so much more that I think the listeners need to hear about. Your analogy of the 3 airplanes going down pretty much every day, like this, you think about just one airplane going down, what an international disaster this is. And, I don't think that we're taking it nearly serious enough. And, a podcast just can't do it justice. So if you don't mind, where can people learn more about this? I know you have a course that people can take. How can they contact you if they have any questions about, reaching their patients? What's the best way to do all that?
The best way to contact me is always through my Gmail, which is my name, sherriwarshaw@gmail.com. That's SHERRIWARSHAW@gmail.com. And I recently have started speaking for Concord Seminars. So you can go to Concord Seminars and see when my next course is. And in that course, it's, of course, introductory. It takes a lot to really be able to treat a patient with this, but at least starting the conversation. And you have such a unique situation when you are in the dental chair, because we have a captive audience. And while you're working on them, again, asking permission, hey, can I share some new information with you? I just found out about smoking cessation, and just educating yourself on what are the products and what is all this e-cigarette business about. Honestly, I could do, if I studied e-cigarettes for the rest of my life, I'd never know everything about it. It's such a monumental industry already. And
it really is.
It's just been here for a decade or 2.
Yeah. Well, thank you so much for being on. This is super enlightening. I'm glad to meet your acquaintance as well.
Thank you. Thanks so much for inviting me, and it was great chatting with you.
Yeah, this is a tale, oh yeah, a tale of two hygienists. So there might be only one, bringing the best of dental knowledge, and we do it all with ease. We cover oral health and screening, and preventing gum disease. We're gonna do a lot of learning, and have a little bit of fun working at the dentist. A tale of two hygienists.